What follow-up appointments or tests will be necessary during and after treatment?
In the beginning, it's a bit more involved, and then as you go, less and less. In the beginning of starting a new therapy, patients are sometimes in the very beginning coming to see the doctor once a week. That might go on that way for a month or even two. But usually, as we get things sort of stable and hopefully very boring, which is the best thing you can be as a patient, we say that's the greatest compliment any patient can get. You're a very boring patient. And as we get patients to that stable place where they're hopefully in remission, patients might be coming to see the doctor every month, every 3 months, sometimes even less, sometimes with just lab visits in between to get simple blood tests done, but really not too involved and hopefully not affecting a person's life too much once they're into it.
During CLL, of course, the typical follow-ups are to make sure that the person is being treated adequately, and is responding, and also it's not affecting other subsets of blood. CLL often renders the patients more susceptible to infections, so sometimes specialized tests are done to see the levels of infection fighting capacity, like antibodies in the blood, immunoglobulins, for example, to see if there is enough of them, and those kind of follow-ups are typically done. Some specific types of CLL is called SLL, which is essentially more limited to lymph nodes. Those have to be monitored sometimes carefully to make sure they are not affecting the other organs nearby. After treatment, again, one wants to make sure that the infection fighting capacities are well maintained. The patients are vaccinated appropriately because they are at a higher chance of infections, and that their blood coagulates well. They are not at an increasing risk of bleeding, and their heart is not terribly affected by the anti-cancer drugs that have been given and so on.
You know, most of the care that folks need after treatment is in the very beginning, again, just to have some social support around. Although most patients don't have any bad side effects, some folks can. And so if people are having any side effects, GI side effects, nausea, things like that, it's good to have somebody around. If the doctor has to call a nausea medicine into your pharmacy, good to have someone around to pick that up. But otherwise, it's fairly simple, common sense stuff. It would be very rare that patients would have to end up in the hospital for mostly any part of these therapies. It's pretty much all done in the clinic and at home.